The United States has recorded the most number of coronavirus deaths in a single day. More than 850 people have died in the past 24 hours, pushing the toll there past the 4,000 mark, higher than China. The death toll has quadrupled in just a week. The grim milestone comes as the number of infections continues to surge across the country. Nearly 190,000 cases have been reported so far, with data showing that the curve has been getting steeper. President Donald Trump says that the worst is yet to come.
We're going to go through a very tough 2 weeks. And then hopefully, as the experts are predicting, as I think a lot of us are predicting after having studied it so hard, you're going to start seeing some real light at the end of the tunnel. But this is going to be a very painful, very, very painful 2 weeks.
There's no magic bullet. There's no magic vaccine or therapy. It's just behaviors. Each of our behaviors translating into something that changes the course of this viral pandemic over the next 30 days.
With 76,000 plus cases and more than 1,500 deaths, New York is by far the worst hit state. It's racing to triple hospital capacity before cases peak in 2 to 3 weeks. Officials are working to set up makeshift hospitals to ease the situation, and residents there have been chipping in.
I've helped set up beds, I've helped set up shelving, I helped move supplies around, and today we just created pathways so people don't have to walk in mud.
The coronavirus has also found its way onto an aircraft carrier. The captain of the Theodore Roosevelt says that it's spreading uncontrollably among the 4,000 crew members. He's pleading for evacuations to be carried out. But Defense Secretary Mark Esper says that the situation has not reached a point where this is necessary. Well, Simon Marks joins us live now from Washington, D.C. for more. Simon, very bleak numbers coming out of the United States in the past 24 hours, with warnings that there's worse to come. The White House has done the math on this. What are their projections of what we can anticipate in the weeks ahead?
Well, absolutely bleak, Dawn. The President of the United States, in that briefing at the White House here last night, said that the next 2 to 3 weeks, in his words, were going to be hell. He described them as very, very tough, and that was borne out by the charts and the projections shared with reporters at the White House by the President's top public health officials. They suggest that there will end up being between 100,000 and now 240,000 lives lost in the United States, but only if everybody all over the country for the next 30 days obeys President Trump's guidelines on safe distancing and obeys the stay-at-home orders that have been issued in many states, but not quite all of them yet. And that is what really terrifies the healthcare professionals. This idea that while in states like Virginia, Maryland, right here in Washington, D.C., we're living under stay-at-home orders, there are parts of the country where stay-at-home orders have not yet been issued by governors, and they're very, very worried about potential new hotspots in some of the country's cities that they're only just beginning to see develop. So there's an intensity of focus now on cities like Detroit, on cities like New Orleans, and Dr. Deborah Birx, whom we heard from there, is very concerned about the patterns of infection in some of those cities, not just over the next 2 to 3 weeks, but over the next 2 to 3 months. The situation in New York, obviously at a crisis point now. We know that's going to intensify in the next 14 to 21 days, but there may be other clusters out there where things are only just developing. So those numbers, best case scenarios now, and the fear of public health officials is that America is still not living in a best case world as far as adherence to the guidelines is concerned.
Simon, it wasn't that long ago that President Donald Trump appeared to dismiss the severity of the virus, but we're now seeing quite the turnaround in his behavior. What gives?
Well, a complete 180-degree turnaround, Steve. I mean, the whole tone of that White House briefing last night was very somber, as it needed to be, given the numbers. But there were also key phrases used by the president that showed the extent of the turnaround. He actually said last night, "This is not the flu. This is much worse than flu." He hasn't said that before. Indeed, recently on his Twitter account, just 2 or 3 weeks ago, he was saying, "Why does a country have to shutter its economy? We don't do that for flu. Why should we do that for this?" The scale of the turnaround also appears to have been fueled by a personal experience that he's had. He said over the last 2 days that he has a friend, he hasn't identified him, an elderly gentleman who was admitted to hospital suffering from coronavirus, and the president says that when he made a call to find out how his friend was doing, he discovered that his friend was in a coma. That appears to have conditioned the president's approach to this, along with the deeply sobering numbers that he was shown by public health officials who said, look, if the United States does nothing to improve its adherence to these safe distancing guidelines, it could be looking at a loss of life in the region of 2.2 million. At that point, the president now acknowledges his entire attitude towards this changed. His critics argue it's changed much too late, and lives have been put at risk as a result of the delay.
And those numbers, they certainly are scary indeed. Simon Marks, thank you for speaking to us from Washington, D.C.